Dear friends, I am Dr. Karthik Nagesh. I am the Chairman and Head of Department of Neonatology and the Neonatal ICUs for the Manipal Hospitals. I am based here at the Manipal Hospital at Old Airport Road, Bangalore. We have here one of the most advanced tertiary care neonatology units of the country, what we call Level 3B. In 1992, this department was started and probably was one of the first neonatal ICUs to provide the highest level of tertiary care, including ventilation treatment, and one of the earliest to do surfactant treatment for babies in this part of the world. Today, I can say proudly that we are one of the leaders in newborn intensive care and have done many pioneering works in this department, so that we are well recognized and reputed as a world-class leader in Southeast Asia and many parts of the rest of the world. We are well recognized for our clinical excellence, the teaching and training services we provide for both doctors and nurses, as well as the academics which we have been continuing, and more importantly the research which we have produced. Our department has a reputation of leading many first treatments in the country, which is the initial works on surfactant therapy for premature babies and their immature lungs. Subsequently, we were the first to introduce high-frequency ventilation, inhaled nitric oxide treatments for babies, first in the country probably to do air transports for babies, and subsequent to that, synchronized ventilation and ECMO. Recently, we've been starting to do a lot of ECMO services, which is called Extracorporeal Membrane Oxygenation for the smallest of babies. In these last more than 30 years, we have been able to look after the most sickest of close to 30,000 babies in this neonatal ICU, and we have been proud to say that we have had more than 95% survival, which is even good and intact survival, leading to good faculties neurologically and developmentally in these babies. And today many of our babies who were in our neonatal ICU in the early 1990s are active and productive members of the society and leading very active professional lives. Some of them are doctors, engineers, and even computer specialists, and even business leaders in the world. We have had a legacy of looking after babies with clinical care, which is excellence. We are proud to say that now we are able to look after the smallest and sickest of premature babies, even in the periviable period. Gestations of as less as even 23 weeks of gestation for mothers who are referred to us with precious pregnancies, we are able to look after very well.